Bismillah ar-Rahman ar-Rahim. I'd like to thank the organizing committee for giving me this chance to present our situation in Kuwait. It's really a great pleasure and a great honor to be with you here in this hall and show you what we have about the NCD in Kuwait. Just briefly, Kuwait lies in the Arabian Gulf, and we are 3,697 people. 32% of them are Kuwaiti, and the rest are non-Kuwaiti. So we are 1,183,000 Kuwaiti, and the rest 2,500,000 non-Kuwaiti. Regarding the NCD mortality morbidity status in Kuwait, I'll just let you know that the cardiovascular system is the most leading cause for the mortality in Kuwait. We have 63.8 is the rate per 100,000 population, and for cancer it's 20.5, diabetes 5.2, COPD, which represent the chronic respiratory diseases, is 1.6. The prevalence of the risk factors, to start with tobacco smoking, we have the percentage of 3% in female, 37% in males, and 20% for both male and female. Actually, this data done by step-by-step surveillance for the Mediterranean approach of non-communicable disease in 2008. For physical inactivity, the percentage of male and female is 55.4. For the overweight and obesity is too high, 75.4. And for the consumption of fruit and vegetables, the percentage of people who ate less than 5 combined servings of fruit and vegetables is 81%. Also from the same source of information, Iman, in 2008. Regarding the discharge of the hospitals for the NCD, which showed how the burden of those diseases on the health system in Kuwait, it's really high. If we go for the total, we have 28,565 cases in 2010. We all know about the UN political declaration, which was last year in September 2011. How did Kuwait respond for that? Responded by doing the high-level national committee for the NCD by the ministerial decree number 6 for 2012. It's chaired by His Excellency the Minister of Health, with the key leaders and representatives from the Ministry of Health and different ministries and governments. The high-level committee is preparing updated, comprehensive, integrated national plan, building on learned lessons of what we have in Kuwait. We have different national plans for obesity, plan for diabetes, plan for cancer. So we try to integrate all these plans in one comprehensive plan that cover all multi-sectors in Kuwait, in total Kuwait. And for sure, this plan should be in line with NCD action plan of the WHO. This is the qarar I just mentioned. Like I said, رئيس وزير الصحة بالإضافة للممثلين من وزارة الصحة, and from, as I mentioned, different ministries. We have وزارة الإعلام, Ministry of Media, Ministry of Education, Kuwait University, the Osman Diabetes Institute, and different NGOs like جمعية القلب, جمعية مكافحة التدخين, all of those. طبعا, to go through all of this, I'll just explain it in English. All the things that what we are going to do in that plan, or what are our strategic directions in the national plan. We have to strengthen the primary healthcare capacity and its role in dealing with NCD situation, strengthen the health information system, update legislation that works to implement the NCD, surveillance and surveys of for sure, promote research, strengthen partnership with the private sector, with NGOs and other governmental ministries, support community-based initiatives, and develop national policies to control exposure for the risk factor. What do we have? Legislation and laws that help Kuwait to implement the NCD programs. We do have a law. It is the National Development Plan. I mean, قانون رقم 9. We have it in الخطة الإنمائية that we have to include NCD in our programs in Kuwait. And also we have قانون number 15 لسنة 1995. It's for banning smoking in all public health areas. Also we have other laws in Kuwait that help and serve NCD, but still we are working on updating this legislation to help us all in the implementation. As I mentioned, one of the important issues is the primary health care. This is the picture of the latest primary health care centers, was opened 2 months ago. Right now we have 92 health centers, aiming to have or targeting to have 100 centers by the end of 2011. Inside these centers, we have different health services that help to implement NCDs, like we have the diabetic clinics within the health centers, we have antenatal clinics that do antenatal services, postnatal services, and premarital counseling. We do have oral dental clinics, labs inside our healthcare centers, vaccination centers, and for sure X-rays. But not all the centers have the X-ray. What clinics we have to help to promote the NCD prevention? We have smoking cessation clinic, obesity management, NCD, well baby clinic, hepatitis B vaccines, which cover 95% of all population. And recently we are going to do a breast cancer screening programs with mammograms inside the healthcare centers. So, how to strengthen our primary health care? By updating drug list. Actually, we have essential drug list for a primary health care. 250 items within that drug list cover all the updated medications to cover the chronic diseases, and we are working on updating this list to cover all the problems that we need. Also, we have to working on updating clinical practice guidelines with referral policies, building partnership with recognized bodies. We have a Canadian accreditation program running on, and of course CME refresher courses all the time. This is just example of what was mentioned in the newspaper about توفير أدوية جديدة للسكر والضغط in the primary healthcare centers. We do have it, but the quantity is varies, but we have all in all centers, especially statin. Statin is available in all healthcare centers. In those centers, we have electronic files. We have PCIS in all primary healthcare centers, where any patient can come to the clinic, just swipe his civil ID card number, then all the information will be appearing on the system in the doctor. Then the doctor can choose either to send him to the nurse or to the pharmacy to get his medication. This is examples of the clinical practice guidelines. This is for diabetes, just done 2011. We have well baby clinic, dyslipidemia, hypertension. This is example of the health promotion clinics, which is breastfeeding clinics. Actually, our aim and target to have more lactation clinics in the primary healthcare centers. Those clinics run by international board certified lactation consultant. We have right now 24 lactation consultants. I'm one of them who serve and do the service for the pregnant ladies and lactating mothers, and to implement the infant strategy in Kuwait. Regarding diabetes, just briefly, in the primary healthcare centers, we have the average day per clinic is 44, average day per doctor is 21. And if we mention diabetes in Kuwait, I have to mention the Asman Diabetes Institute. It's really a huge institute that takes the referrals from all Kuwait, and they provide a comprehensive range of diabetic services run by diabetologists. And it has different specialty like renal, cardiology, dental, ophthalmology. And we do have connection between primary healthcare centers, hospital, and Asman to do the Kuwait Health Network. This is done by collaboration from Scotland, and it aims to different objectives to support the management of chronic disease, link primary healthcare centers with the hospital, provide evidence of change by seeing good outcome. And by this connection, we will be capable to present the clinical information, and at any point of care, we will be able to share information between GPs and to have good referral to the hospital with provide evidence of the outcome, as I mentioned. We have the Kuwait Diabetes Society. It's run by unfunded staff. They have a diabetes register right now. They do, the registration can details 22,000 people, but only they have the name and the diagnosis for the new cases, but not anything more. Now they are working on linking this diabetes registry with the KHN I mentioned before. The same thing for pediatric diabetes registry. And this is just example of the activity for diabetes. This is done by pediatric endocrinologist. She is saying and stating horrible something, saying we have 25 kids diagnosed with diabetes out of 100,000 people each year. So it's a huge number. And she is telling that we are spending a lot of money on insulin pump and treatment, while we should shift our attention to the prevention for those kids by fighting childhood obesity, increase the activity in the school, and healthy diet, instead of putting this high cost on management and treatment. Regarding our second component or strategy direction for the national plan is to create more health promotion environment by doing more health promotion campaigns, more celebrating health, World Health Days, marathons for physical activity, and school promoting health promoting schools. Health promoting schools, this is examples of the activities done, in the community. Regarding health promoting school, there's also announcement from the Undersecretary of Ministry of Education telling that physical activity should be done in all school girls, as if there is nothing before, because the physical activity the years ago, just like something routinely in the school. There's no market for, there's no marketing in the schools, there is no main concern. But now they are shifting to have the physical activity more focused in the governmental schools, and even this is the first time to have a conference on physical activity in the Ministry of Education. If we go for community-based activities, just quickly, we have CATCH, the Kuwait Association for Children Care in the Hospital. We have Beit Abdallah, it's a palliative center for pediatrics, and we have a palliative center for adult من الهيئة الخيرية للإسلام, also it's a donation. The third component is monitoring. We have stepwise surveillance, as I mentioned, 2008. We are running a new one this month, September, and hopefully by the end of 2013 we have the results ready. We have cancer registry done through the KCC Center, diabetes registry, as I mentioned, nutritional surveillance registry done regularly every year, and the Kuwait Health Report. This is what I mentioned about the Kuwait Nutrition Survey. This is the Kuwait Cancer Registry, World Health Survey with the WHO. It's done. The last component of our strategic direction is research, as everybody is mentioning, how to strengthen the capacity of research by building, updating research skills in our health worker, building, updating national database, improving health information system, and strengthen partnership with educational institutions like Jamiat Al-Kuwait and other universities. And this is what it was stated in the newspaper, خبراء كويتيين يقودون دراسة لأمراض القلب. So it's really it's our concern in Kuwait to do more studies and surveillance on the NCDs. Challenges at the end, we need to control advertising and marketing of unhealthy food products like other GCC countries. We should do work on the social barriers for regular exercise activity, like what was mentioned in the morning. We have to have effective involvement of other partners and update legislation. We have to have more self-care protocols for chronic diseases, like self-care protocol for diabetic patients, self-care protocol for asthmatic. We need to shift the attention of our people toward self-care protocols rather than being dependent on the doctors. Updating standard laws for monitoring, a need for reorient health information system to use it in a way that help us to get data and reports on the NCDs, like using electronic files and registering body mass index more in hypertension, smoking, all these indicators we need it for studying. And strengthening the capacity of decision-making, information technology, and communication, and strengthen the capacity of healthcare system at all levels. And this is a statement from Dr. Haifa Madi saying that Kuwait دولة رائدة في تنفيذ الاستراتيجيات and doing all the updated information. Just in the beginning, and that's it. Thank you.
This was a very nice presentation. Thank you.